Starting tomorrow, Hoosiers can once again sign up for health insurance on the federal marketplace. 132,000 Hoosiers and more than 7 million Americans signed up for insurance on HealthCare.gov the last time around from October to March. This enrollment period is shorter, 3 months, giving the uninsured a chance to get covered and those with insurance a chance to shop for better plans. Gretchen Frazee reports on what's changed since the marketplace went online 1 year ago and what Hoosiers can expect in the coming year.
Jay Horry is an associate attorney in Bloomington and had health insurance until a couple weeks ago. Anthem sent him and about 30,000 other customers in Indiana a letter this summer saying they were no longer offering certain health insurance plans because they didn't meet the requirements of the Affordable Care Act.
It said that if I could do nothing and it would automatically roll me over into an equivalent policy, but my rates were going to go up by about 3 times what I was paying.
Horry is now looking to sign up for insurance on the Federal Health Exchange during the open enrollment period that lasts from November 15th to February 15th. He won't qualify for subsidies, but he's still hoping he'll be able to find a cheaper plan than the one Anthem was offering.
I'm in fairly good health as far as I can tell, so save for any unforeseen, event, I should be okay. So that's what I'm just trying to probably go for the catastrophic insurance and, cross my fingers.
Horry is one of about 2 million more Americans expected to sign up for insurance on the exchange in the next 3 months. That's why certified healthcare navigators across the state are preparing for an influx of requests from people who need help signing up for insurance.
I'm preparing folders for consumers and scheduling appointments and trying to get the word out there that we're here, we're ready to help, and we're available.
Questions we've been asked are, of course, is the website going to work? Those concerns. So just kind of the jitters from the first year of going through it and the concerns of, are there going to be more options?
There are a lot more options. Last year, there were 4 insurance providers offering 278 different plans. This year, 5 more insurers have joined the market, and the number of plans has jumped to 975. Janae Green says that means a lot more educating needs to be done, and not just for people who don't have insurance.
We're encouraging everyone, even if they applied last year, to make sure that not just to auto-renew, but to make sure that they look through all the plans, because there may be some other options that will afford them a little bit more insurance than what they had last year.
Officials with the U.S. Health and Human Services Department say even though it might take a little more time to shop around for health insurance, more options is a good thing.
The statistics historically have shown that the more providers you have in an area, the more competition price-wise, and that helps keep prices lower for consumers. So it is good news for consumers on cost, and it's good news for consumers on choice.
Even with the competition, health insurance costs are still going up, just not as quickly as some expected. The base rate for premiums at Anthem, for example, increased 10% this year. 2015's rate increase is much lower.
Our base rate increase was 2.5%. So that's, with all the different factors and all the different changes, that was a pretty good base rate increase. However, for the average consumer, it may look different than a 2.5% based on the way subsidies are calculated.
And making sure your subsidy is calculated correctly is key. Healthcare experts say the 132,000 Hoosiers already enrolled in the marketplace need to update their financial information to make sure they get the right subsidy. Otherwise, they could be overpaying or getting too much of a subsidy and have to make up the difference on their taxes next year. Anthem Vice President Joe Gilbert says that's just one of many aspects of the federal exchange that are still complicated. But he says it's better than last year, and it's all part of the learning curve.
We're in an interesting time now of transition. This is last year was the first year of healthcare reform that was really applicable to the average consumer. So we're going to be in a period of time where there'll be a lot of transition in the market. There'll be different carriers that come and go based on their ability to manage the risk. So I think we're just starting down a very interesting path for the average consumer.
Average consumers like Jay Horry, who says despite the complexity in the marketplace, his goal over the next 3 months is simple.
I'm sure it won't be the easiest thing I've ever done, but at the end of the day, I think it's something that it's what you have to do.
Like this past year, there's a penalty for not getting insurance, with a few exceptions. The penalty for 2015 is $325, up from just $95 last year. If you don't have insurance, that fee will be tacked on to your 2015 taxes. It's been more than a year since the exchange went online, but it's still very complicated. So to delve into this a little deeper and answer a few more of our questions, we're joined by human resources and healthcare expert Chris Schrader. Thanks for being here.
Thank you for having me.
It's hard to believe. I think it was about a year ago we were talking about the website, and it was starting to blow up. And you were talking, I think you said it's sort of like untangling Christmas lights.
Yes,
it's a great
I did.
analogy for this time of year. What's going to happen this time?
I hope it performs a lot better. The expectations are certainly there. Let's face it, it didn't get launched properly, and there's nowhere really to go but up at this point. There's an expectation that it will perform very well. Significant investment, time, and finances were made in improving the site. There are fewer screens for someone to go through. There's going to be a separate path for people renewing to go down so they won't be colliding on the same traffic path with new people coming in. So we're all hoping for a far better experience than last year.
We have numbers from a recent bank rate survey. They asked people who got on the exchange last time around whether they plan to shop on the exchange again this fall. 43% said yes, but most, 51%, said no. Why do you think so many people said no?
I think it's largely because last year's experience was so searing. When you think of how many hours people had to spend by the time they finally got through, it was such a negative first experience. It's human nature not to try to chase a bad experience again. When you couple that with the fact that HHS has notified everyone that has a marketplace plan that if they take no action whatsoever, they'll simply be re-enrolled in their existing plan. You put those two together, it encourages inertia. My concern, however, is that too many things have changed, and it would really be a bad idea to just auto-enroll. Your plan could have changed in this fashion. The price didn't move, but the providers within it did. So your doctors aren't in it anymore, but you don't know because you didn't look. There could be a lower price plan in the marketplace that could affect your subsidy, but you don't look, so you don't know.
We know Indiana still, though, has thousands of people who are not, who are uninsured. Do you venture to estimate how many of those are actually going to go ahead and jump on?
No, I really don't, and it's hard to tell. There are significant penalties this year. Last year's penalty for not having insurance was not as steep as it is this year. So HHS is hoping that that increased penalty will spur people into the site.
And it just seems like things are constantly changing. Will we start to see some normalcy with this program here soon?
I'm not sure we know what normal is, and so trying to project that is difficult. If the site stays up, if people can't get onto it, if the screens move, if it doesn't collapse, I think a lot of the angst around enrollment will calm down quite a bit. Getting the number of people into it that you need and getting the right number of people in the need is very important. Last year was all about enrolling the people who were sick and needed it right away. You were able to bring in people who were paying for individual insurance policies got canceled. This year it's about healthy people. You miss the number and don't get the healthy people, next year's numbers become pretty rough.
All right, thank you very much for being here today.